Hi, everybody, and thank you again for joining us for another informative workshop. Tonight, joining us is Samantha and Michelle from Comprehensive Community Health Centers, and they will be speaking to us about all the services that they offer at their offices and inform us how you can receive access to their services as well. So I'll give it away to Michelle and Samantha.
Hi, I'm Michelle. I'm the outreach coordinator, and I'm based in our offices in Glendale.
And I'm Samantha. I'm the community health worker, and I'm based in our Eagle Rock clinic, but our Glendale one is down the street from me too, so there sometimes also.
Okay, so basically our organization is a federally qualified health center, and what that means is that we do work with basically like the county and the federal government to be able to provide health help to the communities within LA, in different parts of LA actually. And we have 5 different locations, and we do offer a variety of services, as you can see in our flyer here. And we also do, in addition to all these services, we do offer help to the individuals that don't know how to get themselves insurance plan, or aren't really informed on how to get an insurance that fits them properly. So we help them to see what they qualify for and how we can get them to be enrolled in a program within, well, our clinics. You can choose whatever clinic you want, but we do help you with the process and the paperwork and stuff like that. And what me and Samantha basically do for you guys is we get you directly to the needs that you want, rather than you guys just call a number and then go through our call.
You muted yourself, Michelle.
They said the host muted me. But yeah, so basically what we do, we're just like the middlemen between our services and the community, to get you guys faster help, rather than, like I was saying, going through a call center and waiting for an appointment or for a queue. So we get you guys help faster.
It's like a middleman, but a faster middleman.
Yes. And then I don't know, Samantha, if you want to talk about the locations.
Yeah, so you guys are mostly based off of Glendale, I believe, but wherever location is most beneficial, we have in Eagle Rock, in Glendale, Highland Park, and in North Hollywood. And then just depending on, you know, what needs you have, you can pretty much go to any clinic. So if, say, I mean, Glendale has the ones with the most, but say if it's more convenient for you to go to Eagle Rock, but you really just need optometry needs, Glendale's right down the street and you can go to our Glendale clinic. Or if you're closest to Highland Park, but you want to go see the dentist, we can easily schedule you a visit to the dental office in Glendale or Eagle Rock. So just right next to each clinic, it shows what services they have. And if the clinic that is best suited as far as distance to you doesn't have a certain one, we can always get you an appointment at one of the other nearby clinics as well.
And in addition, for those individuals that don't want to go to a clinic in person, we do offer telemedicine, either through video call or through the phone. So if you don't feel, especially with the whole COVID situation, if you don't feel safe enough to go to our location, we could accommodate and get you an appointment with a provider over the phone.
And then really big right now too, because of COVID, we do offer the COVID tests and vaccine as well too in all of the clinics.
And I believe by December, we will also have transportation services. So if you can't get yourself to one of our clinics, you can make an appointment and then call us when your appointment is, and we can arrange for you to be able to get into one of our vans, and we could take you one of our clinics for your appointment. But that would be until the end of the
And I
Do-
think early next year or sometime soon next year, our mobile clinic as well too.
Mobile
Yeah.
clinic. That's cool. How's that gonna work?
Well, the mobile clinic that we're trying to get at the moment is a clinic that's half medical, and I think, I'm not sure if we're gonna have dental or mental health. It's gonna be through telemedicine, so it's gonna be a screen and you can see the doctor, but we would go to site. And I believe it'll also be easier to get vaccines and stuff like that because we can go to a site, and it's a clinic. It'll be federally approved as well, so we can offer a lot of services just within that mobile clinic. So those individuals that don't have time to travel to one of our clinics or something like that, and it's easier to just go to your facility, we'll be able to accommodate with the mobile.
That's pretty neat.
Mhm.
Cool.
Yeah. And also one of the programs that I wanted to talk about, I don't know if any of you might need this or know somebody that might need this program. It's called My Health LA. It's a program for those individuals that don't qualify for insurance. We don't like to say for the undocumented, but it is specifically for the undocumented. It's for the individuals that can't get Medi-Cal, and so we help them sign up for this program that does cover for their medication, their doctor's visit, and most of our services, even some dental work, it does cover.
Okay.
There's more on this one, anything?
That's pretty much it. Yeah, so I don't know if you guys have any questions.
I have a general question in regards to the whole COVID vaccination.
Mhm.
Do you guys do the rapid test, or how long does it take for the results to come back?
It's actually 24 to 48 hours. We don't offer the rapid test at the moment.
Okay.
Mhm.
Okay.
And we do have all the vaccines. We have the Johnson & Johnson, we have Moderna, and we have Pfizer. So if there's also children within 12 years of age and up, we could vaccinate them.
Okay. Oh, and then as far as the whole sliding scale, if they don't have health insurance, how does the whole sliding scale work for them to receive services?
Samantha, do you want to answer? Or should I?
You can.
Okay. So it would depend on each individual's income. So we have like a chart that it depends on where they fit in within our scales. But honestly, it's not that much. And if the person is within low income, it's not going to be really a high fee.
Oh, okay.
Mhm. But again, if the person is self-pay, of course, we can always try to help them to get into an insurance that fits them personally.
Okay. I don't know if anybody else has any questions that they might want to ask, as far as the type of services that they offer. I see a lot of primary care, preventative, behavioral health. Anybody have any questions regarding family planning, optometry, dental, prenatal, pediatric, maybe?
Yeah, I just put this one up too because it kind of gives a little overview of all of the services on this little flyer.
Okay. Anybody with any questions regarding services?
And then if you guys did want or need any help too, I mean, Lisa has like referral forms and all of our contact information. If you feel more comfortable just going directly to her so she can ask us instead of asking a question on here, she can always reach out to us at any time too.
Yeah.
So we have a question. Yeah.
Yeah.
What do you need to qualify for My Health LA plan?
Well, like I said, you need to be, undocumented, which means no visa, no green card, no citizenship. So if you don't have any of those, you would just need to be residing within the LA County, fall into the low income bracket, and that's pretty much it. Those are the only 2 requirements. And if you do decide to sign up, we would just require an ID. If your ID doesn't have your address, then we would need some kind of a proof of address showing that you do live within LA County, and then a proof of income. And if the person earns cash, then it would just be like an affidavit stating that you earn cash, you work in this and this. Or if you don't have any sort of income, again, an affidavit explaining at the moment you don't have an income because of this and this, and yeah, so on.
I have another question regarding documentation for the My Health LA plan.
Yeah.
Let's say the client doesn't have, or the patient, I should say, doesn't have a valid ID. Would that,
No.
cause any issue? Okay.
No. Again, it would be an affidavit. It would just
Okay.
testify, like saying I am this person and blah blah, and that'd be it. But we would recommend that at some point the person bring identification, because My Health LA at times then asks for one. So
Right.
yeah, but if you don't have one at the moment of signing up, we could always do an affidavit.
Well, just because, I mean, for example, like they have an ID or, proof of identification, but it's not currently valid, it's just expired, for example. Yeah.
Oh, then no, that would totally work. We just need to
Okay.
know that the name that you're giving us is tied to this
Is the actual name.
person.
Yeah. Mhm.
Okay. Okay.
And it
Sounds
can be
good.
any type of ID. It doesn't need to be a California ID.
Okay.
It could be a even like for Mexico it's consular. It could be any type of government ID. It doesn't have to be from this specific country or from this specific state. But again, if it doesn't have the address from here, then we do need a proof of address, even if
Okay.
it is a letter or something.
Okay, cool.
Mhm.
Okay.
Yo tengo una pregunta.
Sí.
Okay.
Tengo mi niño que tiene medical, pero no encuentro. Tenía un doctor de los ojos, pero ya se fue, estaba viejito, como que se jubiló
Ujú.
antes de la pandemia, o más bien durante la pandemia. Y no tengo dónde llevarlo. ¿Ustedes agarran medical para los ojos, para el niño?
Sí. ¿A qué doctor no sabe? ¿Sí sabe de qué doctor está
Sí,
asignado?
sí.
Ok, entonces, sí, nosotros aceptamos medical. Solo que tuviera que preguntar que si no hubiera un problema, porque como su hijo está asignado con otro doctor, entonces el problema es que una vez cuando están asignados con un doctor, ese doctor trabaja con otro doctor. Entonces,
Sí.
tuviéramos que preguntar primero a ver si no hay ningún problema que el medical de su hijo sea usada con estas clínicas. Pero no creo que haya ningún problema.
Ok, entonces puedo ir a Glendale, me queda más cerca, creo.
Sí, lo que puede hacer es darles información a Lisa y ella nos puede mandar una referral form para que nosotros primero investiguemos, porque nosotros tenemos acceso a ver la información del medical de su niño.
Claro.
Entonces, podemos primero fijarnos y verificar
Claro.
antes de que usted va. Nosotros les ponemos con el odontólogo.
Perfecto, me parece bien.
Okay.
¿Y trabajan también con centro regional?
¿Qué es centro
Regional center?
regional? Disculpe.
Es una organización que ofrece servicios a niños discapacitados, pero el niño tenía un dentista, pero no me gustó cómo lo atendían, entonces me cambié a otro, pero empezó toda la pandemia y pues no he regresado, la verdad.
Okay.
Pero si ustedes tienen dental y centro regional cubre lo que medical no cubre.
Oh, ok, ya entendí. Yo creo que sí podemos,
¿Chequear
sí
eso?
puede hacer eso, sí.
Ok, entonces yo me comunico con Lisa.
Ok, está bien.
Gracias.
Great. Does anybody else have any other questions in regards to their services or locations? Okay. Well, if nobody else has any questions, like Michelle and Samantha mentioned earlier, if you guys wish to get connected or would like to be referred over to receive any other services, you guys can always reach out to me, email me, you guys can call me, call my cell, text me, give me a call. I'm here at your disposal to, connect you guys in any way I can. And just a little announcement for next Thursday, we're going to have Charlene Gosling comes back and she's going to be presenting her Eating Healthy on a Budget in Spanish. For those of you who speak Spanish, I urge you guys to join, and we'll see you guys on Thursday next week at 6 p.m. And I want to thank you everybody for joining us tonight. I know 6 o'clock can be a very busy time for everybody, so I appreciate everybody taking the time to just log on and be informed. Okay, all right. Thank you guys. Thank you, Michelle. Thank you, Samantha. Have a wonderful evening.
Thank you so much for your
guys
time, and
have
thank
a
you for
good
having
night.
us.
And sorry
Thank
for
you.
muting you, Michelle. It was an accident.
No, it's okay. It's okay. No worries.
Okay. All right.
Okay,
We'll talk
you.
soon.
Have a nice night.
Thank
Have a
you.
good
You
night,
too.
guys.
All
Bye.
right,
Thank you.
Thank you.